So I'm here to tell you about research and development at Hampshire Hospitals, past, present and future. As I say, I have been research director. Siobhan is now research director, but I have hopefully a supportive role as deputy. So what happened in the past? Well, in the past there was no evidence for anything. And we've come to a state where we have evidence-based medicine, which was sort of a phrase coined by a chap called David Sackett, who I had the privilege to work with at McMaster University in Canada. And so he said, you know, why should we use an evidence-based? So if we have a treatment, how do we know it works? And if you want some evidence, then you have to do a trial. And would you want evidence-based practice worked on you? Would you want a drug where there's no evidence it works? Probably not. So you would want some evidence. So if you want evidence, you have to have a clinical trial. So would you consent to a clinical trial? So would you consent to a clinical trial where you might get placebo or you might get treatment? And a lot of you have done. And that is probably the best way of getting evidence that things actually work. And you know, thank you to all the people that do take part in clinical trials. So what else happened in the past? Well, in the past, more than 10 years ago now, we had me working one session. We had a half-pressed R&D manager, and half an admin assistant, and a pharmacist, and a third of a lead research nurse. I never knew exactly which third of her we were using. She was very good. We now have Cindy, who's our lead research nurse full-time. So this was 10 years ago as well. These are lots of things. So we start at the bottom here, which is our research groups, and we plotted out all the things that people did in terms of research in the trust. And we had these sort of 4 rings here. We thought that basically what would happen would these would develop into areas of research that would sort of foster each other and promote each other. And by and large, that has happened. So we thought this was going to happen, and there was a lot of cross-fertilization between departments here. So it has sort of happened as we thought, and the things around the outside are all the universities. So as you can see, there's lots of universities that we've been involved with over the years. So what's happening in the research department now? Well, there's about 50 staff in total. That varies a bit, but about 50. And we get funding from the NIHR, which is the National Institute of Health Research, and quite a bit from commercial trials. And some of the staff are involved in research delivery, and by that I mean that a nurse such as Barbara there would come to see you, and they ask you if you would be in a trial, and they consent you into the trial. So that's research delivery, and some of the staff are involved in research regulations. And as you know, research regulations are pretty detailed. So this is an example of research regulations, and you'll see that there is masses and masses of regulations around research. I mean, in my view, it's too much. It's got to a ridiculous level, in my view, but I'm a lone voice in that. A lot of people feel that they need ultra protection in clinical trials, which is a reasonable view. So there is a lot of protection in clinical trials. You can't just do things without the regulations. So what's happened is that these are the numbers of patients. So these are along the side here. These are the numbers of people in each of these years. So it's not hard to see. It's difficult to see the years here, but this is the last 10 years. And these are the numbers. And you can see the number of you patients that have taken part in clinical trials has risen a lot. And we're just about up to 2,000. So in the last 2 years, it's been close to 2,000. And in the first 4 months of the year, we're up to 1,000. So we're looking at over 2,000 this year. And that does bring in money, brings in salaries for staff, and quite a lot of other benefits which I'll go into. So the problem with clinical trials is that, as you know, they're done initially on animals, and it takes a long time to get the drug into the patient and get it approved. So it does take a while, and there's a lot of work going on in that, but eventually we will get it. So these are, I asked for quotes from the research department about what they thought about what needs to be highlighted in this talk. And these are a few things that we picked out. So research is empowering. Research can be a gateway to accessing treatments not otherwise accessible. Being a research nurse is incredibly rewarding. I think we must have got them on quite a good day, actually. And members of the research team can be inspired to undertake their own research. The other thing that has developed, so it sort of was in the past, in 2014, is that we went to the university and talked to Simon, who's at the back there, Professor Simon Jobson, and others at the university, and we developed this thing called the Hampshire Collaboration for Health Research and Education. And what that is basically a link between the trust and the university in lots of different ways. I won't go into all the different ways, but lots of different ways. And Barbara Parry here, who really has driven that forward in a big way. And there are lots of bits of the university that we're dealing with, and it looks like it's going to be a very fruitful collaboration. And this is Barbara's slide, which is very colourful. I'm not sure what it means, but it's got lots of nice colours in it. And it basically says there are lots of different links with the university. So moving on to what we're doing at present, this hospital seems to produce quite a bit of research. And it's difficult to gather this together because it's in lots of different departments, but if we've got a chap in the library who sifts out all the research papers that are related to the trust. And this is the result. So usually in a year, there's 100 scientific peer-reviewed papers appear in medical literature from this hospital, and that's a lot. You know, that's a lot more than most hospitals of this size. And as you can see, this is just the first 6 months of this year, and it looks like we're going to be over 100 this year. So we're doing all right. So going back a little bit, I expect a lot of you will know Bill Heald, and Bill started producing research in 1982, and this paper related to the mesorectum actually is the most quoted British Journal of Surgery paper of all time. So that's quite an accolade to a chap that really sort of started research at this hospital. And these are his proteges, the colorectal and pseudomyxoma surgeons. There's something slightly weird about this photograph and the angle it's taken from it. It sort of reminds me of Pulp Fiction for some reason.
It's slightly worrying that they're all doing that sort of man stance.
And anyway, they produced a load of papers. So there's 23 papers in the last 2 years. This is an example of a paper here. So they're working hard and they're taking on Bill Heald's work in a big way. So that's one department. So what about the plumbing department? This is the urology department. And they've produced some very interesting stuff on prostates recently. And this is reported in the Mail Online, which is where I pick up most of my medical research. But in fact, what I should be reading is this, which is the New England Journal of Medicine. So the New England Journal of Medicine is the #1 journal in the world for medicine. So if you get a paper in the New England Journal of Medicine, this is world-class research. And so Richard Hindley's down on this paper that Trust was part of this trial, published this year in the New England Journal of Medicine. So this is doing well. This is Merv's Hepatica study. So this is a new study where he's got a £1 million grant into looking at MRI and looking for liver function prior to surgery. this slide is slightly odd here, isn't it? Because this is the liver, this orange bit here. It sort of looks like it's on fire. It looks like this is a piece of liver that's sort of gradually roasting in an oven here. But I'm sure that he's not actually doing that with his microwave machine. But he's got a lot of money from North Hampshire Medical Fund for this MRI software, and has appointed Joe, who's the research house, who's doing really good things with this. I should mention the Pelican. The Pelican is an organisation upstairs that deals with cancer of the pelvis and liver, and principally with colorectal tumours. And they have produced a lot of research, and so they're an organisation that is sort of within the hospital and sort of not, but they do a lot of work with the colorectal team here and liver team here. So there's a lot going on there. What else here? Well, this is the orthopaedic recruitment figures, and in 16-17 it was 31, but with the advent of Angie Dempster, the Dynamic Orthopaedic Research CTA, we now have 207 so far this year. So she pointed out that's a 560% increase. So she's got the orthopaedic surgeons sorted out. No one else has been able to do that. So this is Siobhan's work. So this is an intrabeam radiotherapy device. So if patients have breast cancer, instead of having the operation on your breast, then that's closed up, and then you have external beam radiotherapy, you actually have radiotherapy given at the time of operation into the breast there. And that has been a trial called Target A, and it's moving on to Target B. So HHFT is one of only 6 UK units, and the idea is that patients don't have to come back so often. They don't have to clog up the car park. They don't produce lots of fumes around the hospital. Whether or not it'll improve parking, the consultants car park and down seems to be one of the main problems at present. So I have to mention a bit of neuroendocrine, since that's my thing. I link with King's College mainly, but we have produced quite a lot of peer-reviewed papers and abstracts, and quite a few grants from the URTC. And we're interested in neuroendocrine tumours, quality of life, symptoms. We do have a person in the audience who's one of our NET patients, who tells me that he can give us a record of every bowel motion in the last 15 years on an Excel spreadsheet. So that's the sort of thing that we're involved in. And moving on to microbiology, well, this is a bug here. This looks pretty nasty. This chap called Saeed is really sort of leading the research here with Matthew Dryden, and is producing quite a bit of microbiology research. These are all the trials that they've been involved in. Obviously, microbiology research is terribly important because of resistance of bugs to antibiotics, so it's really important to do that. Are bugs always bad? Well, not always, because we have a paper in New England Journal about viral vectors. So what this is, it's essentially a bug. It's a virus. You have a disease, haemophilia, where there's an abnormal gene. You can't do anything about it. Well, now you can, because you can insert the gene into the virus, and then you can get the virus to take the gene into the patient. So this is very exciting. This was published in December. Savita, who's one of our consultants here, was involved in this study. In fact, she's a first author. So if you're a first author on a paper, a trial in the New England Journal of Medicine, this is world-beating research. So we have some world-beating research here. It's about viral vectors curing haemophilia A. And the idea is that the gene is inserted, the patient's genes are changed, and they no longer have haemophilia. So this is very exciting stuff. So this is cutting edge. So moving down slightly to qualitative research, we have nurses who are doing their own research. So currently we have 2 clinical academic fellows in research Sandown's, and Emily Young. They're doing PhDs. as nurses, and we've got Cindy, who's our new lead research nurse, who is interested in developing nursing research as opposed to research nurses. So these are nurses that develop their own research and publish it themselves, and that's going to be really important. We're linking with the university about dementia and the arts, and David Walters is involved heavily in that from the university. So I'm not going to go on too long, but I just thought I'd say that we do need to get trust board engagement. We have got trust board engagement, but I think we could get more. We need to promote the research activity, keep asking questions, promote PPI, which is patient-public involvement with this. We need to help increase the visibility of research, and we need to share it with the commissioners in particular. So these are the old chaps in the present that do research. Old chaps and lady, I should say, that do research here. But there are new people doing research that are younger and are going to take it on to the next level into the future. There is one that belongs in the last slide. I don't know how he got into this slide, but it should be in the last one. So why is research important? Well, as has been mentioned, it empowers the clinical staff. They know what they're doing. If they've seen the research, they know that it works. It will improve retention of staff, because people will want to stay because they feel that it's a forward-looking organisation. And as Alex mentioned, research-active organisations have a better quality of care and, curiously, have lower mortality rates. I'm not sure I completely understand why that is, but there is evidence that lower mortality rates exist in research-active trusts. And this is from BMJ, so there's quite a few papers published on this, and it's worth a look. So what's going to happen in the future? Well, I think we need to get the whole trust involved in research. It needs to be what's called a research active trust. We need to increase the links with the university, and we need more collaboration within and outside the trust with commercial organisations, etc. I think we personally need a research fund for the trust, and I was talking to the North Hampshire Medical Fund earlier about this. I think that some of the funding should actually go into research so that people actually give money for it. And we maybe need more visibility of research within the trust board. And there is talk about whether we should be a university hospital, which I suppose would be hoofed. But we could talk about that. So I leave you with a quote from one of my favourite authors, T.S. Eliot. We shall not cease from exploration, and the end of our exploring will be to arrive where we started and see the place for the first time. Thank you very much.